Let's go to a hospital now and find out what's going on there. We know that doctors and hospitals in Gauteng are absolutely overwhelmed by the number of patients coming in. But are other provinces experiencing the same influx, or are they offering a helping hand to Gauteng? Well, let's speak now to the CEO of eMalahleni Private Hospital, Dr. Elsabe Conradie. Dr. Conradie, thank you so much for your time this morning.
Good morning, and thank you very much for inviting me.
Dr. Conradie, what does your capacity look like? Are you receiving patients from Gauteng?
We do. We even receive patients from as far as Piet Retief. All the hospitals here in Redbank really struggle. eMalahleni is, it's not a small town. It's actually classified as a city. And our hospital is, our COVID beds are completely filled up. So even the other hospitals, we try to help one another. When someone has a bed available, we try to accommodate those patients. And the problem is that it's not the mild cases, but it's also a lack of ventilators. And so many of the patients with this Delta virus, the emergency of the cases or the seriousness of the conditions of the patients so much higher, and that is really making our lives difficult in terms of having enough ICU beds, high care beds with ventilators, so that we can ventilate the patients really needing the ventilators as well as oxygen.
Dr. Conradie, I'm really interested in what you're saying, and it's important. Do you have a TV or radio or something on there? Because I'm getting a lot of feedback.
No, I don't.
All right, then we can't fix it together. Let's carry on then. Are you getting patients transferred either by Medivac or by road from Gauteng to eMalahleni?
Not so many at this stage. The majority of the patients are here from Mpumalanga and eMalahleni itself, and the smaller communities around eMalahleni.
You were saying earlier, of course, that eMalahleni, formerly known as Witbank, is actually a city. It's a big area in Mpumalanga. There are a lot of people working on coal, etc., in the area. How is your bed space looking overall when you look at the hospitals in your area?
We are all full. The other hospitals here in eMalahleni as well. Cosmos, that's the One Life Hospital. They constantly phone us and ask, please, do you have beds available, because they are really struggling. So together, we try our best to help the patients where we can, but it is a struggle.
Tell me on a personal level how you and your staff are coping.
Well, we struggle. That's the other issue. In eMalahleni, we really struggle for enough nursing staff, and registered nurses, enrolled nurses, and assisting nurses. So it is really a struggle to find enough staff members, and staff members are really, they're tired, and they can't cope anymore. So even the well-being of the staff, we enrolled in a program to assist our staff members with their well-being because of the conditions. And so many patients pass away, and that is the sad thing, due to the seriousness of this virus. It's not, and that also have a terrible negative effect on the staff members. So emotionally, hard-working, have to cope with personal lives versus the hospital life. It really is a struggle. So this virus, this Delta, is terrible, and I can't warn people enough. Please be careful, take care, and go for the vaccination if you can. We really need to stop this virus as soon as possible.
Dr. Elsabe Conradie, the CEO of the eMalahleni Private Hospital, begging people to please take all necessary precautions. And as the President said last night, complacency comes at a cost.